United Healthcare collected $6 billion in illegal Medicare payments in 2023 by coding you as sicker than you actually are. Humana grabbed another $4 billion the same way. Your tax dollars are funding this fraud, and the Department of Justice is going after them. But Medicare Advantage plans still are getting paid more when you are sicker. For every diagnosis code they submit to Medicare, they get thousands more of dollars per year. The problem with this is that they're submitting diagnosis codes for conditions that you don't have, conditions that you were never treated for, or conditions that aren't properly documented. The government calls this what it is: fraud. So what I recommend you do is you request your complete diagnosis list from your Medicare Advantage plan today. Call the number on the back of your insurance card and ask for every single diagnosis code they've submitted to Medicare on your behalf. You have a legal right to this medical information. So here's how this fraud works, step by step. Medicare pays your insurance company a monthly amount to cover your healthcare services, but that amount changes based on how sick you are. If you have diabetes, they get more money. If you have heart disease, even more. The sicker you appear on paper, the bigger the check Medicare cuts to your insurer every month. So your insurance company has a massive financial incentive to make you look as sick as possible. You visit your doctor because you've been feeling tired. Your doctor runs some tests. Your blood sugar, it comes back at 115. That's slightly elevated, but it's not diabetes. Your doctor writes in your chart, elevated glucose, recommend diet modification. A few weeks later, your insurance company's coding team reviews that same chart. They see that same 115 blood sugar reading. They change the diagnosis code from elevated glucose to diabetes type 2. Medicare now pays your insurer an extra $3,200 per year because you're coded as diabetic. But you never received diabetes treatment. You're not taking diabetes medication. You don't check your blood sugar. And your doctor never told you that you have diabetes. Your insurer just turned a borderline lab result into $3,200 in annual profit. And they do this across millions of patients with thousands of different conditions. Medical records still shows what your doctor actually wrote, but the billing code submitted to Medicare tells a different story, a more profitable one. This isn't a billing mistake. According to the Department of Justice, when insurers knowingly submit unsupported diagnosis codes, they're violating the False Claims Act, and that's fraud. The numbers from the Alliance of Community Health Plans analysis are staggering. United Healthcare's members appear 36% sicker on paper than members of nonprofit health plans. Humana's appear 19% sicker. These differences can't be explained by actual health status. Both types of plans serve a mix of healthy and sick people. The only explanation here is systematic upcoding. Over the next decade, this fraud will cost Medicare $600 billion in overpayments, according to MedPAC, which is Medicare's advisory commission. Your Medicare Advantage plan has several tactics, and they're all designed to generate more diagnosis codes. Home health visits. They send nurses to your home for free wellness check. Well, these nurses aren't necessarily there to improve your health. They're there to generate billable diagnoses, and they test for everything. They document every minor symptom you've ever had. Each yes answer could become a diagnosis code submitted to Medicare. And there's also chart mining, where they hire companies to review your old medical records looking for any mention of any condition ever. If you had anxiety mentioned in 2019, they can add it to your 2024 risk score. Never followed up on, never treated, but it increases their payment. Another one is problem list padding. Doctors keep running lists of patient concerns in medical records. Your doctor might note, rule out sleep apnea because you mentioned snoring once. The insurance company's coders see that note and submit sleep apnea as a confirmed diagnosis. You never had a sleep study. You don't use a CPAP machine. But sleep apnea just got added to your permanent risk score. Then there's vendor assessments. They contract with companies that specialize in finding diagnosis codes. These vendors get paid based on how many new codes they identify. The more codes they find, the more money everyone makes. Except you see none of this money. Risk adjustment itself is legal. Medicare designed it so plans covering sicker patients get paid more. That's fair. What's illegal is submitting diagnosis codes that aren't supported by medical documentation or for conditions you weren't actually treated for that year. The False Claims Act makes it fraud to knowingly submit false information to get government money. The Department of Justice has already secured over $1.8 billion in settlements from Medicare Advantage plans for exactly this. Cigna paid $172 million, Martins Point Healthcare paid $22.5 million, and the DOJ is actively litigating cases against United Health, Elevance, and Kaiser Permanente right now. In October 2023, federal prosecutors brought the first criminal charges ever at a Medicare Advantage upcoding case. They charged an executive with orchestrating a scheme that caused millions in overpayments. So this isn't just civil penalties anymore. People can go to prison, and they should. So here's what this costs you. First, higher taxes. When Medicare Advantage plans steal $50 billion per year through upcoding, that money comes from taxpayers. You're funding their fraud. Second, contaminated medical records. Your record now shows conditions that you don't have. Try getting life insurance or long-term care insurance or a Medicare supplement plan with diabetes, sleep apnea, and chronic kidney disease on your record when none of those are actually being treated. Third, wrong treatment. A new doctor sees all those diagnosis codes and treats you for conditions that you don't have, or they order unnecessary tests, or they prescribe medications that you don't actually need. So here's what I recommend you do. First, call your Medicare Advantage plan today. Request your complete diagnosis list, not the summary, every single diagnosis code they've submitted to Medicare for risk adjustment. You have a right to this under HIPAA. Then compare that list to what your actual doctor has diagnosed and treated. Look for conditions that you've never heard of. Look for conditions mentioned once 5 years ago that you never got treatment for. And then challenge any incorrect codes that you see in writing. Send a certified letter to your plan listing every diagnosis code that's wrong and demand they delete it from your risk score. Keep copies of everything and then report it. If you find widespread upcoding in your records, file a complaint with Medicare at 1-800-MEDICARE. You can also report it to the HHS Office of Inspector General's fraud hotline at 1-800-HHS-TIPS. I'm CALLIE Navarrete, a licensed insurance broker and founder of NaviQuote. If you checked your diagnosis codes and found something wrong, or if you have questions about your specific situation, give me a call or schedule an appointment. My information is in the description below. I can help you figure out what's going on with your Medicare coverage. And drop your questions down in the comments below. I read every single comment, and your questions help me know what topics to cover in a future video. If you found this video helpful, be sure to hit that like button and subscribe to the channel so you don't miss my next video. And after that, click right here to check out my next video with more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.